Here, we want to make sure that you're the focus and your concerns are the focus, and that we test for things that are going to give you answers in the long run. There's no reason to restrict what we're giving you for care and providing you just because your insurance only will cover certain things. We want to make sure that it's clear that you want answers and you want to feel better, and that's what we're going to do for you. We can talk about everything that we need to start on, what your priorities are, what are the biggest concerns, and then kind of take steps according to how you feel comfortable and the physician feels comfortable together. Normally, after that, we'll get you scheduled for a follow up, which is usually about 4 weeks. At that point, we can get you started on some of those treatments and protocols and kind of see what you're feeling like, what those results were, making sure that we're making progress in one direction or another, or if we need to shift something in your treatment plan. And then eventually we'll get you on a 6 month protocol to see your doctor, with those visits and those follow ups every 6 months, where it's kind of things are more maintaining, things are more progressing in the right direction. You're starting to feel better. And what I've found, and I think a lot of patients have found through the practice as they've gone through their journey with us, is there's a lot of patience involved. I mean, you do have to have patience for your own body. It's one of those things that you think about. I've waited all this time to come and see us, where we do things completely different than what you're used to in a primary care practice, where they don't look at it as a holistic approach and a full body approach, and you're going to start feeling your body is off a little bit, or you need to kind of get back in alignment, or there's things that progress over time or develop, and we all can't stop aging, unfortunately. So then things are going to come up as we get a little bit older, and we want to take proactive steps. I know it's things are expensive and you want to save money and you want to wait until you absolutely have to see a physician. But I tell you, if you focus on the overall wellness of your body and you take the right approach to coming in for follow-ups every 6 months and really addressing anything that's changed, we're getting your blood work done, we're looking at prevention, and we're looking at treating things and before they get to illness. We want to make sure that our physicians feel part of your plan, and making sure that your lifestyle changes are something and modifications are something that you can maintain throughout your whole life to make sure you feel your best at all times.